open the meeting.
There we go, we've just started.
Thank you very much, Jo. Good morning, everybody. So we've formally started our Council of Governors meeting. Welcome to everybody to our meeting of today, the 13th of July. Really delighted to have you all here. We are, I think, perhaps one governor short to be quorate still. So in terms of implications, if there are any decisions that we need to make through the course of the meeting, then we're not quorate to make those decisions, unfortunately, which really emphasises the importance of getting as much attendance as we can at the formal Council of Governors meetings. But we can arrange, obviously, after the meeting to write to colleagues who weren't present to ask for their support during the meeting for any items that we've concluded. So just to emphasise that, but we have had apologies and conscious that it is holiday season or the beginnings of a holiday season for people. So a number of governors have given formal apologies, and for the record, those are Amy Clifford, David Jones, Linda Cox, Lloyd Cox, Sharon Wormsley, Krishna Yatharaj, Richard Amponza, and Mark Major. Oh, and Sue Watts as well. We have also... Sorry, was that...
Richard actually has cancelled his leave, so he is actually here today.
Sorry, Richard. I paused on that momentarily because I thought, well, I've seen Richard, but I didn't want to sort of say that. So sorry, Richard. Thank you for, well, you might not have cancelled your leave to come to Council of Governors, but thank you for being here anyway. So we will correct the record on that. Sorry about that, Richard. And we've also had a few executive apologies, but Angela can't be with us today, but David Mayer is Deputy Chief Executive. You've met David before, and so he'll be leading on the Chief Executive slot. And Scott Adams, who's one of our non-executive directors, has also given his apologies along with a few other executive colleagues. So I think that reflects holiday season, as I've said. But am I right in thinking that somebody else has just joined? Is that a governor? And are we at 10?
Yeah, Carol's just joined, so we're now 10, so we're now quorate, yeah.
Great. So we are now quorate, so that's excellent. That does mean that we can make some decisions today, which is really helpful. So item number 2 is declarations of interest. We do have our log of declarations already in place. It's just an opportunity, if there's something very specific on the agenda today for governors or other colleagues to make a particular declaration around, there is an opportunity, so I'll pause if anyone wishes to do so. Otherwise, we'll take it that nothing on the agenda is of a particular conflict for anybody today. We do have minutes of our previous meeting, which was the meeting of the 11th of May. I'm not going to go through page by page, but I will pause just to check whether colleagues are happy that the minutes reflect accurately the meeting that we had last time. So if you do have any concerns about anything that's captured in there, then please take the opportunity to highlight that now. Okay, and on the basis that nothing, no inaccuracies were highlighted, I'll take it that the minutes of the previous meeting have been approved. I think there, again, an opportunity if people would like to raise any matters arising from those minutes, please do so. But we'll move on to the action log in the meantime. There is one outstanding action, which is action 61, governors to be asked to sign the new code of conduct and invited to submit expressions of interest for the standard to join the standards group, which we talked about at the last meeting. Both of those things have now occurred. So all existing governors have signed the code of conduct. There are a couple, I think, outstanding for new governors, but that's part of our process for making sure new governors are in place anyway. And also the standards group has now got full membership. So I propose that we close that if everyone's content that that action is completed. So please indicate as we go if there's anything that you're not happy to support. Probably easier for you to indicate that. Please feel free to do so. It is your council and your opportunity to make your voice heard in terms of any decisions we're taking. So please do indicate if you're not happy to approve anything, and we can obviously stop and debate any points that you wish. Okay, so that's action log. If there are no matters arising from the last set of minutes, then we move on to the first main session of the Council of Governors, which is our session on constitutional matters and the Director of Corporate Governance report. So on this, I hand over to Richard Smith. Richard.
Thanks very much, Krishni. Good morning, everybody. I'll refer you to paper D in the previously circulated pack of papers. I won't go through all of the items in there. I will, however, focus on 5 areas within the report. As we've already found earlier in this meeting, attendance at meetings is proving to be a little bit challenging to pin down. We understand that people have other commitments, so we're really seeking all governors' support in just confirming whether or not they can attend meetings so that we know whether we are anticipating a quorum meeting or not. We've included some details in the report of some of the measures that we're taking to try and make it a bit easier for people to let us know. We appreciate there are lots of things happening and people have got busy lives. So we'd be really grateful, A, if you could let us know when you're not able to attend or when you are, and B, if there are any of those methods that are working more or less effectively, as we can then fine tune our approach to make it as easy as possible for you to communicate with us into the future. And this will then be fed into the broader review of the effectiveness of the Council of Governors, which you'll all have the opportunity to contribute to, which will be launching in September. So the second area I wanted to highlight is quite a large piece of work that we're doing on membership engagement and representation, and certainly thanks here to Tracy Davies from the governance team who's leading this work on our behalf. Within the report, we've started to set out some of the arrangements that we've put in place for our annual meetings. So this is the annual general meeting of the Council of Governors and the annual public and members meeting, which is taking place in September on the 18th at 5:30 in the evening. I don't know, Tracy, whether you want to give us the latest position, because we had a meeting of the Planning and Implementation Group on Monday, and this report was produced before that meeting had happened.
Yes, so the planning group met on Monday, which featured a couple of governors, a non-exec director, which was Judith. We had members of our team, communications team, learning and development and IT. So all the key people we need really who are involved on the night, essentially, to help us pull together the meeting. Governors may remember I think it was the May meeting, we agreed sort of the outline agenda, in that we agreed it would be a virtual meeting. We would hold a very similar format to last year, and that our focus would be on compassion and partnership. So Monday's meeting was really to talk about the practical arrangements. So we have agreed a couple of case studies that we're going to put in as part of sort of the more interactive elements. We picked a physical service and a mental health service. So we're just fine tuning who those speakers will be. We're also preparing for the governor video, and we've just had a workshop session before this session, which we've helpfully agreed some useful content for the governor video. For anyone who didn't join the workshop, if you want to be involved in the video, please do let me know, because new governors can get involved as well as people who were around last year. So really the meeting on Monday focused on how we're going to sort of advertise the events. The members bulletin is due out next month, so probably in weeks now we're talking. So that's one of our main areas. It did go in editions yesterday, which went out as well as an advert. So really we're now focused on the practical arrangements for September. So hopefully we get a good turnout in September.
Thanks very much, Tracy. Yes, I would encourage all members of the council to tap their networks and let people know when the meeting is happening. So often word of mouth is often a good way of boosting attendance at the meeting. And for those that haven't perhaps attended one of these meetings before, they are certainly not the dry meetings that perhaps other organisations run. We do have lots of interactive content, so we have not least a governor video celebrating some of the achievements the council's made over the last year, but we have some colleagues from services coming in talking about interesting areas. So please do encourage people to attend, and there's a fairly straightforward registration process through our team if you want to do so. So in other aspects of the membership work, we have been making some good progress, I think, with the membership priorities that we agreed earlier in the financial year. So on page 4, we've just highlighted some of the progress that we've made against those 5 priority areas. Fairly early days, it is fair to say, admittedly, but nonetheless some good progress there. And we'll obviously be taking this forward through the Governor's Membership Engagement and Representation Group, which meets I think 4 times a year. On page 5 of the report, then, we have set out some of the things that we've done in response to the feedback that we've had, and thanks very much to governors here and those that have not been able to attend today's meeting for their feedback and suggestions in this regard. So you can see that we've listed in the table some of the things that people have requested. So some of the in-person engagement opportunities, for instance, and participation in local activities. We've just described some of the things that we've put in place already there to let you know how we've developed our offer in response to your requests. If there are any further ideas or suggestions, again, they'd be very gratefully received. This is something that we're learning about as we go, and through the membership committee, we'll look to finesse that offer as we go through into the year. So 2 things in particular I wanted to highlight amongst that list of things is we are launching 2 new forums, one in the north of the county, one in the west of the county. These are for governors. And we will have NEDS and the corporate governance team joining these forums, which will provide an opportunity for local debate on topical issues in your area. For those governors that don't represent a geographical area, we are hoping that you will join one of the forums and contribute from your perspective, be it as a patient or service user or as a partner. So again, we'd look to evaluate these new forums as we go, but hopefully that provides a more of an informal setting, and we're going to take the opportunity to actually hold some of those meetings in person at some of our trust sites. So for those people that have said, I'm not really sure what you do at Isbrook Hospital, if you're involved in the North Forum, you'll actually get to have a meeting at Isbrook Hospital and have a look around. So do look out for the dates of those. We'll start to get those organised very shortly, and then we'll look for your feedback on how effective they are. The other thing I wanted to highlight is an innovation that came out of the workshop we had with KGH earlier in the year, where we heard from the place director for North Northamptonshire Council, Ali Gilbert, on the progression of the work on the local area partnerships. This is, of course, a county-wide development, so the west of the county is also developing local area partnerships as well. The system is trialling 2 different models, and in the north there is the opportunity for governors to get involved and participate in these groups. So we will be again looking for governor volunteers to participate in these groups, and we'll be in touch with colleagues in those areas accordingly to elicit interest. And the final aspect I wanted to highlight in relation to the second area of this report on membership was the aspect of governor pledges. So what we wanted to do to make sure that we're able to support you in doing your role over the coming year was to ask you to make a pledge to let us know what you're planning to do over the year. This doesn't need to be something spectacular, although that would be great if it is. It could be fairly something straightforward, but this allows us to tune into actually what do you need from us to support you to do your role over the coming year, but also then gives us something when we're thinking about preparation for the next annual report and accounts, something to reflect back on and say, well, these are the things we committed to do. To what extent did we achieve them? So we'll be coming out to you after today's meeting just to get your feedback on what you're planning to do in your role as a governor over the coming year, and we'll look to then share the outputs of that exercise at the council's meeting in September. So moving through into the third area that I wanted to highlight this morning from the report, we're looking at the most recent workshop that the Council had with the Board of Directors, which took place in June. Firstly, thanks to everybody that participated in that session. Certainly I was there and found it really quite inspiring, quite a useful discussion taking place. Thanks also to Peter Howie, who's been doing some work with us, who facilitated the event and also brought his expertise as a retired company secretary to bear. So there's sort of two key outcomes really from that workshop that we're looking to seek your views on this morning. The first is what we originally were intending to call the Concordat or the Charter, which we're now proposing to reframe as a statement of principles. So we had a good discussion, I think, between board members and governors on how we work together, and we felt that actually having a short statement of principles, which you can see in Annex A on the second page of that annex, the outputs of that workshop. So once I'm finished sort of presenting the report, I will be seeking the Council's approval for that approach, and ideally for that form of words which was drawn from the outputs of the workshop. And the second area that we've been working on, again, was a long-standing piece of work in reviewing our governor, what originally started as welfare protocol. As we heard last time round, we'd reframe that as a well-being protocol, and we can see there in Annex B the I hope final draft product on which we're seeking the Council's approval. Thanks very much to the governors and other colleagues that have contributed to this document, not least those that attended the workshop in June, where we had the opportunity to see the latest version. Certainly I think we've got a version now that reflects the feedback that we've received from governors, and also I think tunes in quite well to the Trust's overall approach and strategy to well-being. So moving forward then into the fourth area, we've been also having a look at governor training. So those that have been reading the Trust Constitution will know that the Constitution specifies required training for governors as something that we all need to do. We've reviewed the original requirements that we've had in place for a number of years, as the feedback we'd received was it's not necessarily particularly relevant to the governor role. And we took the opportunity, therefore, to review good practice from other organisations and reflect on national guidance as to what was actually required now in foundation trusts. So we've thankfully come up with a much shorter, more focused list of courses which we're proposing would constitute required training as part of the Council's constitutional definition, which we've listed on page 8. So this list of required training will of course be supplemented with those role-specific training courses, which I know governors have really enjoyed participating in, such as the NHS providers offer, the core skills training, and for those that are part of non-REM, the recruitment training have been very well received, and that will remain part of our offer going forward. So then the final area that I wanted to draw out of this admittedly rather lengthy report, apologies for that, was the most recent session that we had with our colleagues at KGH. So on the 19th of June, we had the latest in the series of joint governor briefings on the integrated care system with colleagues from Kettering General Hospital, NHS Foundation Trust. At this meeting, we had the opportunity to hear from two colleagues from the Integrated Care Board, Karen Spellman, who's joined as the new Director of Strategy, and James Gillespie-Allen, who heads up public engagement. And so we had the opportunity to explore the newly published 5-year joint forward plan, which was approved by the Integrated Care Board at its most recent meeting. As the name suggests, it sets a 5-year plan for the system, so for the Northamptonshire system, and responds to the Integrated Care Partnerships previously published strategy. This is a really important document for the system, so it was great to have the opportunity to be able to have a discussion with Karen and colleagues about what it contains and really what it means for NHFT and the people that we serve. And equally, governors, I think, heard about an exciting new development from the system's perspective, the Engagement Insight Library. As the name again suggests, this is a collection of useful resources for governors potentially that are engaging with members and the public on things that are happening in the local system. And in addition to being a lending library, we can also contribute to the library with our own case studies and contributions, which we'll certainly be looking to do. So those are the areas that I wanted to highlight in particular this morning. And aside from taking any general questions, what I was hoping really is to seek your approval for the proposed statement of principles, the wellbeing protocol, and the required training. So with that, Krishni, perhaps I'll hand that to you to take any questions. And I can see there's quite a bit of chat action, which I'll catch up on as well. Thank you.
Thank you very much, Richard. Just to help, I mean, there was one thing that Joanne raised. I think there is in the report, the careers in the NHS webinar, which I think, if I'm right, is due later in the year, isn't it? It's one of the ones we've planned. And Joanne just wanted to check that other AHPs are invited. But I think the principle, if I'm right, Richard, is that everybody is invited. We would like as many people as possible to attend it. It's a really good opportunity to hear about that. So, Richard, do you want to comment further on that?
Absolutely, yes. We are looking to boost attendance at these events. They really are open events, so there should be no barriers to attending. So certainly, yes, Therapy College is very welcome to attend. Tracy's coordinating the actual content for the course. So equally, if there is some contribution that you wanted to feature, Joanne, thinking about careers in AHPs, then yes, please do link in with Tracy. We'd be really grateful for input in designing that session. Thank you.
Joan, do you want to come in?
Feel patient. Yeah, that would be great, Richard. Just to say that, we would like to contribute and promote, other AHPs promote their professions alongside everybody else. That would be great. Thank you.
I'm sure that would be very welcome, Joanne, and really important. There are so many different options, so we need to make the webinar inclusive around the range of options. So I think it's, at the moment, it's a theme, I guess, rather than one that's specifically been completely designed. So there's a real opportunity to influence that, Joanne. So thank you very much. Any other questions regarding any of the content? As Richard said, it was a lot has happened, so there's quite a big chunk of stuff in there for you to take on board, and I'll take you through what we need to decide on. But if there's any other questions of clarification, please do ask. Tracy, do you want to highlight anything specific?
Yes, I was just going to mention on the training, I'll be looking for some volunteers from the governors, because we're actually using a new e-learning system for what we used previously. So to start with, I'm going to ask for some volunteers just to help us test the system and make sure that governors can get logged in before we launch to the wider sort of governing group. So if anyone would like to volunteer, this doesn't include staff governors, because you obviously do your training as part of being a member of staff. So if any other governor would like to volunteer to sort of help us with that, that's just one request I would make. And also, as we mentioned, the member webinars, I'd just like to highlight the one we've got coming up on Talking Therapies Health, which is the week after next on the 26th of July. I know we do have quite a few governors booked on, but if you could help us promote or book on if you haven't already, that would be great.
Thank you, Tracy. And I think that one is it's really important, because I think there is, Talking Therapies are, the Talking Therapies service is available for people to self-refer to, I believe. And so actually people really understanding that is important. So promoting this event and really kind of helping people to understand what the service does, I think it's a really valuable opportunity for our community, really. And I think in the past, Richard, if I'm right, we've had the Talking Therapies team speaking similarly perhaps at our last year's annual meeting, in fact, if I remember correctly.
Yeah.
So for all those reasons, it's a service that we really like to promote, because it's an important offer for people who need that support. Okay, just check. Julia, do you want to come in?
Thanks, Krishni. Just to endorse what you just said, I recently did a service visit to the IAPT service at Lotus House in Northampton, And I had no idea, really. I've seen all this sort of information about it, but I really hadn't understood the impact of that service for the many, many people that they work with and the different ways of delivery. And they've got some fantastic ways of developing staff, from peer support workers, people with lived experience, and supporting. So I just urge everybody, please dial in if you can, because you just, it just brings a service alive. So thanks.
Thank you, Julia. And just I know some colleagues will be sort of still getting to grips with the terminology, but IAPT stands for Improving Access to Psychological Therapies, and I think because the name itself was sort of seen as somewhat perhaps difficult for people to understand, I think it's beginning to be described as talking therapies now, so that people are, but we will no doubt still use the description IAPT occasionally, so it's understanding that those two things are the same things. Any other questions or comments before we go to approving a couple of those things in the report? One other thing I just wanted to highlight, I don't recall, Richard, you mentioning it, you might have done, but just to mention, we have had a change of governor representation from Northamptonshire Council. Richard, did you mention that or okay?
No,
so I just wanted to mention that because we've had a different nomination. There was a change took place on the 25th of May. I think the council had agreed a change, and so we're just letting the council, that's Northamptonshire Council had agreed a change, and they've advised us that change took place on the 25th of May. So we're obviously in the process of onboarding the new representative from Northamptonshire, which is just important for you to note. So so there'll be a change of representation from that authority. Matt, talking about authorities.
Yeah, thank you, Chair. I just thought I'd mention that bit in the report. It mentioned the local area partnerships and the opportunities for governors to get involved with the North. It says it's a North only opportunity, and we are, just to confirm, we are doing things very similarly, but slightly different, and we are totally committed, obviously, to making what we do in West Northants as effective as possible. But we do have a slightly different approach to the North. So I just wanted to give you some assurance that we are working really hard, because the local area partnerships bit sits within my portfolio at West Northants to make that as effective as possible. So I'll be very happy to give a report on that at some point if you wanted me to. Thank you.
Thank you, Matt. And actually, one of the opportunities that's probably coming up, Matt, is for, obviously we'll be going on to, Roshni's going to be doing her input shortly on her role as a partner governor. And I think it'd be really interesting, Matt, to get you at some point. I mean, there's a whole load of partner governors, but obviously you at some point to talk about your role as a both as a partner governor on our council, but also in your capacity as chair of the Health and Wellbeing Board for West Northamptonshire. So if you're in agreement, we can think about
I'll be happy to. Maybe through Tracy we could sort that out.
Yeah, absolutely. And I think also it's perhaps an opportunity, once we've been through the experience of governors being involved in the North opportunity for LAPS, we can share that and see if, Matt, if there's any learning that can be shared across as well. So I think all those things are opportunities, aren't they? Great. Well, thank you very much, everybody. And thank you, Richard, for the report. So we're asked to note the report. That's the first point, which I think we do. The council is asked to approve and support the proposed statement of how the Council of Governors and Board of Directors should work together. So there were, I think, 5 principles in Annex A, which are very, very straightforward, which I hope everyone will support. The council is also asked to approve and support the Governor Wellbeing Protocol, which is very much about how we, as Richard explained, support you in your role as a governor, and that's in Annex B. And then the other bit that was particularly important for you to support was the way forward on governor training, which, as Richard emphasised, is actually a sort of reduced burden of mandatory training for governors. So hopefully you'll welcome that change, because we obviously wanted to make that as pragmatic as possible. So can I take it, unless there are any concerns about any of those things, can I just check that everyone's happy to support those proposals in the report? Governor's content, please do highlight if anyone's got any issues, otherwise I'll take it that we're happy to support it. Lovely. Okay, well, thank you very much, everybody. So we now move on to the session where we have an opportunity to hear from governors about what they do in their roles. And we, as you will recall, we had a number of our staff governors talking to us about what they do in their day job and how they bring that into the council as well. And today we've got, I think last time, did we have Mark? Was it Mark Majors last time, or was that before? Oh no, it was Sharon, wasn't it, last time, representing the REACH Collaborative. So we've had now two partner governors speaking to us, and today we've got Roshni Khatri, who's our partner governor representing the University of Northampton. So Roshni, over to you.
Thank you very much. Tracy, are you happy to share the slides?
Yep, can you see the slides? They should be up now. Yeah.
Thank you. Good morning, everyone. Can you hear me? Yeah, perfect. Okay. Thank you very much for giving me the opportunity to talk about my role as a partner governor, as well as giving you some information about the university. So I'm Roshni Khatri. I'm an associate professor for learning and teaching at the university. I'm also head of health professions and a partner governor for NHFT. So I've worked at the university for 20 years this September, and I'm very proud to be part of this organization. I'm an occupational therapist, and stroke rehabilitation is my clinical background. But I also lead on the allied health professions programs here at the university. So Richard, absolutely. I'm very, very keen to support you in promoting those professions, and we have loads of resources that we can share with you and work together on that. I look forward to that. So as a head of subject, I look after podiatry, paramedic science, midwifery, and I used to have occupational therapy and physiotherapy, but they've recently moved to a different subject area because we're about to introduce speech and learning therapy, dietetics, and operating theatre department practitioners in September 2025. So these are really new, exciting opportunities for the university. I also have a role for curriculum development, and I work with partners. So, for example, I work with Oxford, the John Radcliffe Hospital, which is part of the Oxfordshire University Trust, and we quality assure all of their master's program provision for their staff. So that's one of the other roles that I have at the university. I teach on various undergraduate and postgraduate programs, and I also supervise PhD students. So really, the best part of my job is I have the privilege of being part of many students' journeys as they work towards being our future healthcare professionals. And the best part of my job is watching them grow and become passionate about the professions they're about to join. I also have the pleasure of working with our practice partners and support their educational journeys as professionals. So I support and guide many clinicians through their master's programs and their PhD studies. And this ensures that we continue to develop our leaders of the future in these professions. It's very rewarding. It's a very rewarding and fulfilling job as I get to meet so many people from such diverse backgrounds and get to work with so many different organizations, for example, NHFT. But life is not without challenges. And in recent years, like everybody else, our greatest challenge was to keep our staff and students safe during the pandemic. We work with all our partners to ensure that our students continue to support the NHS during the pandemic. And to be honest, like everyone, we're still dealing with some of those challenges. One of those difficult issues that continues is of course a lack of placements for our students. And we understand how under pressure all our partners are. But we want to work with NHFT and all your linked organizations to make sure that our students gain the kind of experience they need before they join the workforce. So next slide, please, Tracy. So before I get into how we can work together, just a couple of interesting facts about the university. It might be interesting to you that that the University of Northampton is actually the third university in England after Oxford and Cambridge. And it was established by Royal Charter in 1261. However, within 4 years, it was banned because it proved to be a threat to Oxford and Cambridge. And it's been noted in history that when the scholars protested, they were hung from the walls of the Northampton Castle. So yes, the university was quickly shut down, but again, it was started up in 1924 as the Northampton Technical College, and then we grew to become the University College of Northampton in 1999. And that original ban had to be reversed in 2005 so we could gain university status again. So we're the first university in the UK to be awarded a Changemaker status by the Ashoka U Foundation, and I'll talk about that a little bit later. Currently, we have about 14,000 students and about 3,500 partners that we work with, and NHFT is, of course, one of them. We also have our new and lovely Waterside campus, and it would be amazing to have all of you come and have a meeting, and you can visit our campus and our facilities. And we moved to the new campus in 2018. We currently have 3 faculties, which is the Faculty of Business and Law, Health Education and Society, and Art, Science and Technology. Next slide, please. So yes, we spent 330 million on this project, and we have a really lovely new campus. We were all a bit hesitant before we moved because we really loved our old campus. But now that we are on our new campus and it is based along the waterside, hence it's called the Waterside campus, it is just stunning, and we feel very grown up as a university. It is exciting because we're based in the town centre, which gives it access, to the local community, and it's been always the vision to have it as a community campus. So you often see people, walking groups going through the university, mums and tots groups, and of course we've just started our first park run last Saturday. So we're really looking for all sorts of opportunities to engage with the community at large. Okay, next slide, please. So how do we teach? We slightly different from other universities in that we use a blended approach. And that doesn't mean that we do all our teaching online. But what we've moved away from are those very large 4 and 5 hour lectures given by one person. And what we really do encourage is a lot more face-to-face teaching in smaller groups, using discussions, using seminars, using workshops. However, we do use technology to enhance our learning. And actually, when the pandemic started and we had to move all our provision online, we didn't struggle as a university because we had all the technology in place when we moved to our new campus. So we do use active blended learning, and it is one of our unique selling points at the university. Next slide, please. We're also an international university, which means we have over 1,000 international students from over 100 countries, and we really do encourage this. And this is not just in our other faculties, but also within our Faculty of Health. It just means that they bring such a rich and diverse load of experiences and cultures to our learning and teaching. And we're doing a lot of work around making sure that the curriculum is beneficial to all our students, including our international students. So we're really looking to diversify our curriculum and make sure that it is applicable to those individuals and who are going back to their home countries. Next slide, please. So one of the things that I mentioned earlier is that we are a change-making university. And that means that we went through a process about 5 or 6 years ago, looking at every module we deliver in every faculty. And every module leader had to consider how what they were doing within their module was going to improve the social outcomes for the people that they work with. So whether you were a lawyer or you worked as a historian or whether you worked in health, you really needed to look at the social impact you were making. And because of this extensive work that we were doing, making sure that all our programs were changemaker friendly, we are now the #1 university for social impact in the country. And we have lots and lots of amazing stories that our students can share with you about how they've gone back to their organizations, how they've gone back to the communities and made a real big social impact on the people that engage with them. And these are all available on our website. So this is something we're really proud of. And really, I'm going to use an example or give you an example of an organization that we work with here in Northampton. So a couple of years ago, probably about 4 or 5 years ago, we had Reach for Health, which is a charity based in Daventry, that approached us and asked whether we would work with them to help them do some research. And when I got to understand what the charity was doing, we realized that they had one physiotherapist and a businessman who had an amazing idea of putting equipment in the gym and allowing people that have long-term conditions to access those facilities. However, they weren't able to address the needs of all of those individuals because there were only 2 individuals at that time, and one of them was a physiotherapist. So what we did was we offered them placement, and we now place occupational therapy students, physiotherapy students, mental health nursing students, sports rehab, and a podiatry student within that organization. And they've grown to such an extent that they've moved to larger premises. But they really give an opportunity for the wider community to engage with them, to receive professional input, but also on a social level to be able to go somewhere where they're accepted, they feel safe to engage in physical activity to improve their well-being. So this is just one way that we can work with partner organizations here to support the work that you're doing. Okay, next slide, please. So I'm based within the Faculty of Health Education and Society, and we have programs that include nursing, midwifery, paramedic science, podiatry, occupational therapy, physiotherapy, psychology, social work and social care, education, special educational needs, children and young people. And the reason I wanted to go through this list is if there are any organizations that are present here today that would require any of those services, I'm really happy to have a conversation with you about how we can support student placement. And of course, we have our service user and carer group. So yes, after this meeting, or you have my contact details in the first slide, please do get in touch because we can really look creatively at the way we can work together in order to make sure that your service users have access to the professionals that they need. So this is something that I really want to spend some time on, and it's about how we can all work together. So firstly, I'd like to mention our service user and carers group. We have a large group of service users that engage with us at the university. They help us do interviews for all our new staff and all our new students. So all our health programs have service users on their interview panels. We also have service users that help us develop our new curriculums. And it's a requirement at the university that we always have service users present when we're planning new programs, when we're validating older programs, but we always have an opportunity for service users to contribute to that process. Our service users also come in to do teaching, and they help to support teaching sessions, so we can really bring real life examples into our teaching. So our service users and carers group is not just about service users coming in and doing teaching or supporting our programs, but we also do extensive work with them to make sure that they have sufficient training, they have access to education, so that it's mutually beneficial for the university and for them. So again, if there are any organizations that want to highlight the service user group, please contact me and we can look at how your service users can join our group so that they can contribute to some of the work that's being done across the university. The second thing that I really want to mention is placement. And you've heard about the example of Reach for Health. So you might not have professionals, that offer rehab within your program or nursing care, but there are other creative ways that we can offer placement and perhaps offer supervision from the university in order to make sure that we can work together on placement. We really do want to set up a group that is working much more closely with NHFT to look at how we provide placement because we always have a shortage, and this is a national issue that we need to work on together. We also do a lot of work on educating staff. So we probably quality assure training programs, master's programs. So if there is specific training that you require within your organizations, again, have a conversation about how we can go forward and do that. Another big area that we can collaborate on is research. And often organizations that are trying to meet the needs of their service users don't have the time to do research. And we have loads and loads of students that require innovative research projects. So, we just take that work off you and, you'll get the supervision and the support to help some of those research projects. So that's another area that we can work a lot more closer on, which will be beneficial for our students because they go away with those very, very important research skills. But of course, you can also gain all the data that you require within your organizations. So there's a huge potential here to create partnerships, and I'm really happy to have those conversations following this meeting. Hey, next slide, please. So I know this is a whistle-stop tour about the university. There's so many different ways that we engage with NHFT already, through student placements, through different projects. It's really impossible for me to use 20 minutes to talk to you about them. But thank you for taking the time for listening, and I'm happy to take any questions or for you to contact me at a later stage to talk about some of the things that I've mentioned today.
Roshni, thank you very much. Really good to hear about the university. I had no idea about that interesting piece of history. How fascinating, going back to those times when the university was opened and closed. I should have to read up about that because that's really fascinating. Yeah. Sounds rather frightening as well, I have to say, in terms of what happened once it was opened. And I think, really interesting opportunity to think about what Roshni can contribute, Richard, I think, to the webinar that we're planning on for, is it November? I think that one.
It is.
So that might be quite useful, a bit like we did with Sharon, where we were doing sort of, involving partner governor in the presentation. So just something we can pick up on that, I think. Would other colleagues like to ask any questions? Please feel free to come in. So first of all, Julia.
Thanks, Krishni. Hi, Roshni. I'm Julia Curtis, one of the non-exec directors. Hello, I've got a nursing background. That was a fantastic overview. And I suppose I'm just sitting here feeling quite positive for the future, having sort of listened to the new NHS workforce plan that's out and all the implications of that and new roles, and we've got to work very differently. And the fact that we're now into a new integrated care system and all that brings. I'm just thinking for the future, what a really positive set of ethics you have and practical ways you want to get involved so that we can really make a difference. So yeah, congratulations. And I think that it makes me feel really positive for the future. Thanks.
Thank you, Julia. Yeah, absolutely. We will try and work creatively with anybody to make sure that we can have the positive outcomes for the county. Thank you.
Thank you, Julia. Robin?
Hi, Roshni. I don't know if you know, I'm an associate lecturer on the social work course at the university and have taught that course on and off for over 30 years and supervised students on placement. And the opportunity for student placements within HFT, I know it is taken up already, but the potential for that is a good illustration of how, for related profession, there is already an existing very good interface between NHFT and parts of the university. So the more of that we can develop that in other areas of practice, the better. But there is a really strong link already.
Thank
Great.
you for sharing that, Robin.
Thank you, Robin. Susan.
Hiya, I just wanted to talk about is it the same as any other university to be able to get a placement? So do you need your functional skills? Do you need, like, for instance, mental health? Do you need your mental health level 3 and functional skills and stuff to join?
Susan, that would really depend on what program you wanted to join.
Yeah, I'm sorry. I'm just thinking the mental health. I think it was. So I wrote it down. Yeah. So the OT, for instance, or the children and young people. What experience would you need before getting a placement?
So in terms of providing placements, these are placements that we have within our partner organizations. So if you represent an organization, it might be appropriate for you to have a placement. So one of our students will be placed with you. And we just go through a process of auditing the organization and looking at the facilities and then how we can work together in order to broker a placement for our students. Does that answer your question? Or are you looking for a placement for yourself?
Yeah, I am, and I didn't see that bit was covered, and yeah, if I think of a question, I try and cover it for myself because others might be thinking the same. So yeah. Thank you.
Thanks,
That's really
Susan.
helpful. Thank you.
Thank you. And actually, so I think we've got one more from Matt Golby. Matt.
Hi, Roshi. I'm Matt Golby. I'm a partner governor from West Northampton Council. And I was interested to hear what Robin just said about the links that you already have. That was a part of my question. And one of the other part, I guess, was do you know how many people actually stay in the system in Northamptonshire and contribute? Because you obviously do a lot of work to get them here in the first place. And you know, I like your challenge. Can we work together? What more can be done so we get those people to stay and contribute to the sort of the needs of our own system? Thank you.
Yeah. Absolutely. We have data on how many people stay within the system, and I'm happy to share that at some point. We are more of a home university, and we do attract people from local areas. So, and we try and make sure that we place them locally so that they get an idea of what kind of services are available locally. However, in the last probably couple of years, we have been attracting people from London and the wider area. And, you know, some of them stay in the county, some of them go back. But over and above all of that, we are more of a home university and attract people locally. Specifically for our allied health professionals, we're doing a piece of work looking at the reasons why people are moving out in the county. And once we have all of that data, I'm happy to share that here because I think it'll be valuable information for not just AHPs, but other professions as to why people are not staying in the county and moving out. So yeah, I'm happy to share that.
Yeah, a really important question, Matt, because I think, you know, obviously, as far as we can, we want to, you know, it's not always going to be possible, clearly, but we want to attract people into the area and kind of make Northamptonshire an attractive place, not just to study, but to live and work after people have studied. And so that's really important. And I really like, Roshni, the references you made, because I think this accords with some of the conversations we've been having within NHFT about social impact and sort of community, you know, the concept of a community campus, which I really loved. And also, so how do we encourage you know, everybody, staff and the students to really think about the value, the social value that they bring to Northamptonshire and the difference we can make together. So I thought that came across really powerfully. One thing I just wanted to clarify, the service user group you were talking about, is that clinical service users who are helping to inform the training, or is that students who've been through the training before? I was just, we obviously talk about service users very much from a clinical point of view, but I just wanted to clarify that because I thought that was interesting.
Yeah, I'm sorry if that wasn't clear. They are clinical service users, so they actively and accessing services at the minute. So they bring very live examples into our teaching. You know, rather than us saying this is what a person that has a stroke feels like, we would bring somebody that has actively engaged with stroke services to make sure that it's real for the students.
Yeah, and I thought that must be the case, but I just wanted to be absolutely clear. That's really good, isn't it? That's another example of how important it is for us to hear service users' voices in everything we do, whether it's design of services or in the training of people who might be delivering those services in the future. Roshni, thank you so much. That was really interesting. Lots of food for thought. So really, really interesting to hear your experience. And we shall pick up, I think, at the specific opportunity that might be there for us to think about how we involve you in the webinar or contribute to the webinar in some way going down the road. And I do think that also Richard and I might want to debate whether we can think about using your campus for a meeting or something like that, which again, I think would be really practical way of sort of connecting as well. So thank you so much.
Thank you for giving me the time.
Great. Thank you, Roshni. So we're going to move on then to our next section, our session 2, which is all about strategy and assurance. And first and foremost, item 7 is the reports of the chair and chief executive. Now, what you have in your papers are papers ENF, are the papers that went to the last board. I haven't got any particular updates that I want to give following in relation to my report. I think Richard has covered quite a lot of that in his Director of Corporate Governance report, but obviously I'll pause in case anyone's got any questions relating to my report before I hand over to Dave Mayer to talk about the Chief Exec's report, which is not so much a focus on the report itself, but an opportunity for Dave really to give you a sort of what's live and in the moment and what's on the agenda for Dave and the executive team within NHFT, because there's a lot going on, as you can, I'm sure, imagine. So if there's no questions for me, then I shall hand over to Dave and Dave let you go forward. Thank you.
Thanks, Krishni. Hi, everyone. I'm David Mayer. I'm the Managing Director for the Trust, and warm welcome to new governors, who I'm sure I'll get to know in due course. And Roshni, I've got some feedback about our Anchor launch, which was at the Northampton University. Your Vice Chancellor there hosted it. So you're already kind of helping pull the county forward in terms of the Anchor movement. So thank you for that. Just a few things, I guess, just to brief people on. So nationally, colleagues would be aware that we're entering another period of strikes with junior doctors this week and consultants next week. As a trust, I think we're pretty well prepared for that, and our thanks go to all our colleagues, really, those who are striking and those who aren't, for keeping patients in mind and making sure we can still operate safely during this period of time. We've also complied, of course, with government agreement with unions around pay. So we have kind of initiated that as part of the nursing strike settlements, but we continue to experience disruption to services through those the remaining strikes that are happening. So just to keep people aware, and I suppose to a certain extent reassure that we've got a handle on it, and I feel as a trust we're managing that quite well and in line with our values. The second thing, I guess, nationally of note is the workforce plan for the NHS was published. That sets out a 10-year framework for training of staff, retention of staff, and general workforce reform. So just some key headlines, I guess, for us and relevant to some of the detail that Roshni gave us earlier. So medical places will be increased by up to 15,000 a year, quite a significant move in apprenticeships as a model of of developing a workforce, so both internships and apprenticeships, and I think we welcome that. We've got quite a good apprentice pipeline in HFT, and that expansion I think is welcome. There's then a piece of work on retention. So the aim is in 10 years' time that we will have retained about 130,000 people who would have left the organisation to go work elsewhere. So retention features quite strongly, and we've obviously focused on that in NHFT in terms of our work and trying to make this a really great place for people to work, and for the county to make it a really great place for people to live and to stay, which feeds into Matt's point earlier and Roshni's kind of presentation. And then in terms of reform, I guess helpfully for us, there's an expectation that we would grow community primary care and mental health workforce by about 73% over the course of the next 10 years. That's significant growth in primary care and community workforce. And we've had some significant growth in mental health workforce from the 5-year plan. So again, this is really welcomed stuff for us, I think, and signals some positive movement in terms of the parity of esteem in terms of mental health and community care, alongside kind of elective and acute-based services. And then obviously there's a bit of a focus on AI and emerging technology, with an expectation that universities will be supported to move to a 4-year graduate or non-graduate program, but leading to a graduation program for medical degrees. So that's kind of big news. It's big because we've been waiting for it for a long time, and there is money behind it, 2.4 billion, but with some wrinkles to be ironed out in terms of how the practicalities of hosting that quantum of new workforce is going to work, and the training capacity and so on. So a step forward in the right direction, but more to do. So that's kind of generally some of the national picture. We also had the Hewitt review, the independent review of the Secretary, the previous Secretary of State, Patricia Hewitt, on ICSs. And I guess just to note on that, Patricia Hewitt put forward a proposal for an increase in prevention spend, and we're really interested in that as a trust, about how do we get really upstream into communities so that we prevent people needing to access our core services. So that was welcomed, and we hope to eventually see some of that enshrined possibly in local policy at a minimum, but certainly in national policy. She's put forward a figure of about 1% of spend increase in prevention activities. So keep an eye on that. We're doing some work on it locally, and that's positive news too. In terms of local things that are arising that we're working on locally, some good news on a new chair for Kettering and Northampton General Hospitals. We've got now somebody in the ICB doing digital, so we've often had feedback and conversations in this forum about digital and how important that is to get right for an integrated system. So it is really great to have Kirsty Watson now leading that piece of work with all of our individual IT and digital teams involved. And of course, we've had the Wellbeing Festival, which again has gone down a treat with colleagues, and you can watch all of that online for those of you that have missed it. So I'll close off on just a few high-level things that I just want to have governors aware of. We are, as a system, going through an efficiency program, as you'd expect post-COVID. This is a national program of work trying to ensure the NHS can balance its books after some pretty heavy lifting over the past 2 to 3 years. We've got an internal value program. We're looking to do some really interesting things with places, working with Matt's colleagues in the local authorities around new integrated models of care in RIBU beds, recovery independence beds in North and West. So that's modernising our community estates, and that's really exciting if we can get that right. We've trialled and piloted a model already in the West, and the feedback has been very positive. We're also looking at workforce very critically. So can we grow our own, and can we minimise use of agency to try and ensure we don't overspend on our workforce? And that's an area of concern across the NHS. It's not unique to NHFT by any stretch. It's just the nature of where we are post the pandemic. And then locally, we've published the 5-year forward plan, which Councillor Golby and colleagues have kind of endorsed, which is a roadmap over the next 5 years for the ICB on things we're going to focus on, digital obviously being one of them, access to healthcare, another, mental health and so on. And we can make sure our colleagues have a link to that when we send out the notes from this, so you can access it and have a look at it. And then just finally, we had a really great AHP nursing conference with a real big focus on compassion. Linda and our Director of Nursing and colleagues led on that, and feedback has been fantastic with a compassion tree where people can put their pledges for going forward, which we're going to try and get kind of enshrined for prosperity and put up somewhere. And then finally, just an update on our award winners. We had a number of chefs who have successfully managed to break out into the open with 2 chefs from Ironbrook featuring in the NHS, getting silver in the NHS catering awards, and we've got Andrea Raymond named Caterer of the Year by the Hospital Caterers Association. So I just think that's really nice, just to reflect on the importance of food in people's recovery journey for those that have an inpatient stay with us, but also the hidden stars that make a trust and an organisation work, people who are behind the scenes but are doing absolutely amazing work, and just wants to make sure they have some visibility to you as governors, because I think that's really important. Thanks, Krishni.
Thank you very much, Dave. Thank you. And just picking up, I think a copy of the workforce plan, which is publicly obviously published in the public domain, but a link to that has been placed in the chat for you if you wanted to look at that. And also a link to the Wellbeing Festival, which actually is, you know, in my experience, I haven't watched it, but I was on holiday myself last week, so I couldn't partake. But certainly when I've watched it back, there's some great sessions usually that you can watch, and you can take part in some of the activities. So the beauty of being able to record these things and share them with you is that you can still benefit from the guidance and the tips and advice and exercises and all sorts of things that tend to be covered. And the great thing also about the Wellbeing Festival is it's across Northamptonshire, so it's open to all staff. So it's a genuine system-wide festival, and please do watch it back or flick through the bits that you're interested in, because it's a lovely thing to offer to all our colleagues who, you know, for whom wellbeing is incredibly important. Now, in the interest of time, I'm going to suggest that we move straight on to the final session that we have today, which is a risk and assurance topic from Judith Seymour, who's going to talk a little bit about some work we're doing across the East Midlands, but particularly relating to CAMHS, the CAMHS Collaborative. What I'm going to suggest, though, is if anyone's got any other questions for Dave, please put them in the chat, because we can, when we get to the end, we can perhaps sweep up any questions that we have or take away any questions that we haven't been able to answer today, and make sure we come back to you. So please do that. But in the meantime, I'll hand over to Judith to cover the East Midlands Alliance and the CAMHS Collaborative. Thank you, Judith.
Thank you, Krishni. Good morning, everybody. I'm going to, as Krishni mentioned, going to talk about CAMHS. This is a massive collaborative, so I'm going to have to do a little bit of a canter through. So Tracy, could I just have the next slide, please? Thank you. So I wanted to actually start, for the sake of those who are new and haven't heard of either CAMHS or the East Midlands Alliance, there's a little bit of getting rid of the mystery of the acronyms. So the East Midlands Alliance is in effect an alliance of 5 mental health trusts from Derbyshire, Lincolnshire, Leicestershire, Northamptonshire, Nottinghamshire, as well as, and this is quite unusual, St Andrews, which is a charity located in Northamptonshire, providing specialist mental health care. So that's East Midlands Alliance, and if I can just go to the next slide, please. And their objectives are very much what you'd expect a collaborative objective to be, which is to share learning, share strategic oversight of the collaboratives, strengthen working relations and delivery for the NHS long-term plan, and provide collective voice for the mental health, learning disability and autism in the region. So under that umbrella of the East Midlands Alliance, can I have the next slide, please? We finally get to CAMHS. Now, getting rid of another acronym. CAMHS stands for Children and Young People Mental Health Service. So I did try very much to get rid of all of them, all the acronyms, but just stop me if there is something that isn't clear still. Now, it's quite important to understand something as complex as CAMHS. And I thought quite carefully how to present this. So I thought I'd start off with what the vision and what the objectives are, and then work through each of them one by one to show you what the deliverables have been. So very high level, CAMHS vision is to put patients, children and young people at the centre of everything that we do. It's a really, really broad vision. And under that, there are 5 very specific and in some instances overlapping objectives. Can I go to the next slide, please? Thank you. Now, the first objective is to establish a single point of referral for CAMHS. Single point of referral is SPOR, and that was the first objective because it was felt across the 5 mental health trusts that there are so many different touch points where children, young people could approach, and there was a real confusion around that. So that has in fact now been established, and there is a case review system. And the clinicians meet 3 times a week to discuss the waiting list and also how to prioritise the children on the waiting list, children and young people on the waiting list, to ensure that their clinical needs are met. The other thing that is very important is delayed transfers of care. So looking at the, if you like, the other end of the service, which is where a child or young person has been admitted into an inpatient unit, where there has been a delay in discharging them back into the community, into their homes or some other place, why that is taking place, and that is being very carefully monitored. So there's a very strong, if you like, grip, and the NHS likes that word, there's a very strong grip on the waiting list and how that's managed. And what the outcome that has served is that there has actually been a very large reduction in waiting, young people waiting for service for their needs to be met. Can I have the next slide, please? So objective number 2 was to develop an intensive home treatment service as an alternative to inpatient admission. So the position is very much, and there's clinical research on this, that those who are cared for in an environment like home or somewhere in the community are more likely to respond to treatment rather than those who are within an inpatient environment. Clearly, not everybody can be treated in such environments, so that's a clinical decision. However, this intensive home treatment is now referred to as CAMHS 3.5, and I'll go and explain that a little bit later. But it was felt to be very important also to reduce the pressure on beds. So this CAMHS 3.5, the intensive home treatment, is now in place across the entirety of the East Midlands. And so that's an incredibly large area, and that's been incredibly successful because that also has had a positive impact on waiting lists and beds. And in order to support the families, because clearly if families are caring for children, young people at home, they themselves need support. A family ambassador role has been brought into the collaborative, where the voice of the family and how they're supported in order to provide this care is facilitated. So the number of referrals into inpatient services has been reduced by 20%. So what we have is a reduction of young people actually appearing in A&E departments, which is incredibly distressing. And their needs are being met in the community and therefore much closer to home. Can I have the next slide, please? Objective 3 is very much an objective around the collaboration that is needed in order to ensure that this whole collaborative can work. How can solutions be built across the region, so these 5 different mental health trusts, and how can clinicians work together in order to facilitate that? So in order to, in addition to the meetings that the clinicians have, there are also been additional lunch and learn sessions where they share their ideas and if you like, it's a brainstorming of what works. We've noticed that this works. Have you noticed that? Is that something that you could potentially learn from? And by doing this, the outcomes has been very much around the introduction of new technologies to support staff in specific instance in their own well-being, because if the staff feel well within themselves, they are obviously able to take care of the children and young people better. So there have been a number of joint initiatives to support staff, also from a recruitment point of view, because as you may imagine, 5 separate mental health trusts all have different recruitment needs and recruitment budgets, but this is a collaborative and needed a collaborative way of recruiting staff into the collaborative itself. So there were legal issues, employment law issues and such like that needed to be ironed out, and that's now in flight. So that's been done. Can I have the next slide, please? Objective 4 was around delivering an integrated working with other system partners. So that is looking outside, if you like, the NHS, looking at more of the system working with social services and the integrated care boards and the third sector, because in order for tier 3.5, so the intense home care to work, there needed to be partnership working with other partners as well. That is in place, and the commissioners for the Integrated Care Board have been engaged, and they are linking with local authorities to support this type of commissioning. And therefore, again, the outcome is comes back to the same thing. There's been a reduction in both in waiting lists, but also in attendance at A&E departments. Can I ask the next slide, please? And the last objective is really about the education. Is how do you raise awareness amongst clinicians, not just within our region, but also in other regions, as to what the benefits are in delivering treatment differently. And the clinical reference group, which is very important within this type of environment, because it is a group of clinicians and bear with me, clinicians and commissioning leadership, as well as policy and the patient public voice. So there's all these different representatives coming together in the clinical reference group. And in order to get that teaching, if you like, that education, it's the clinical reference group that needed to be brought on board. And they're very much in supportive, and they're able to, and they have supported the single point of referral, the face-to-face access, which is part of the Tier 3.5 service, which is a community-based access, meaning that patients get a face-to-face assessment before there's any further referral to inpatient services. And it's been found, the theory is that if there's a community service and a face-to-face community access, then the inpatient stay can quite often be avoided, and there's a faster recovery. And the detail, just to remind you, is a delayed transfers of care, which I've already alluded to. Now, I've sort of rattled through quite quickly these 5 objectives. There are 2 specific committees at trust level that reviews progress within the CAMHS Collaborative, and that's Performance Committee that I chair, and also the quality outcomes and the safety outcomes are also reviewed in Julia's committee, the Quality and Safety Committee. So there are a number of touch points that NEDS, as I have in relation to CAMHS, and a number of places that we gain assurance. Just to give you a little bit more flavour as to the type of partnership working that has been happening. For instance, NHFT has worked with is currently working with acute trusts in order to create one, if you like, bringing together 2 units together on the Berrywood site in order to ensure that there is an inpatient unit that is 1 unit rather than being separately placed, which means that staff are more supported, they have greater access to other clinicians that may be needed, and also it goes back to this single point of referral that is something that the collaborative has been working towards under Objective 1. Now, the last 3 slides, I've got to apologise in advance. Can I go to the next slide, please? Are going to be really busy and for you on screen probably quite illegible. It's very difficult to put something as complex as CAMHS onto slides, but what I'm trying to show here and in the next 2 slides is a little bit of a, if you like, a bigger picture. Clearly, NHFT and the CAMHS Collaborative are only one part of the mental health support that children and young people within Northamptonshire receive, and some of that help actually starts much earlier, before obviously inpatient or community-led care. And this table here shows the different tiers, which is the, if you like, the severity of the care, or the severity of the symptoms or issues that the children and young people face. And the higher the tier, the more likely it is that NHFT is involved. And by tier 3, we're definitely involved. But tier 2 is the more milder type of impact on the child. But it's a partnership. It's a middle column, if you like, that is very interesting because it summarises very neatly how many different partners that the collaborative works with in order to deliver, if you like, a total care, a 360 care for children at all stages of their health and well-being. Can I have the next slide? And this slide is the visual representation of where NHFT are involved in this process, and anything that's highlighted in red is 100% NHFT provided service. But if you can see the bottom of the bottom part of the slide, the different colours indicate exactly what it is that the children and young people are getting to support their wellness. Is getting advice, which is really at school level, which is the green. Then the getting help, which is a slightly more ratcheted up service. Then getting more help, which is where really NHFT get involved. And then, of course, the inpatient, the getting the support they need in an inpatient unit, which is the yellow. So you can see that right across children's wellness and health and wellness, NHFT are involved, but also there are a number of other partners too. Can I have the last slide, please? Now, this last slide, again, is a really, really busy one, but it shows you the model of how all these different partners, including NHFT, work together. And as you can see, the child is right in the middle. And it's all the support mechanisms that are being put in place, the advice and the help and the information that is put around that child by the different partners. And the partners are in that wonderful ochre colour, not quite sure what to call it. And that is a very, very wide range of partners, not only the families and communities, but schools, the acute trusts, and also the third sector. So those are my slides. If we can just stop sharing there, Tracy. I recognise that this is a very important and large area. What I really wanted to get across was not only the complexity, but also the different touch points that NHFT have across supporting children and young people, and the types of assurance that we as NEDs get, and how we feel assured that this service is being run, and that the children and young people are getting the service and support that they need. Really happy to take questions. I might not be able to answer them all, but I have other NED colleagues in place. So Joanne.
Hang on a mo, Judith, because I just want to emphasise we've only got 5 minutes, so we're going to have to be really sharp on questions. So I can probably take a couple, but actually, if you could again use the chat if there are other questions we haven't been able to answer, so we can pick them up. Just a bit of context, I think, just to sort of go back to the bigger picture. Really important to say the East Midlands Alliance, this was an opportunity for all of us to, CAMHS Tier 4, which is the sort of inpatient beds, has been a real challenge for the NHS for years, and actually not having sufficient beds and young people maybe being sent far from home. So at its simplest level, collaboration is about trying to put all our resources together to support as many young people as possible, as close to home as possible. So the collaborative opportunity that came working together with the East Midlands Alliance really helped us to think about how we put our bed base together, our clinical resource together. CAMHS consultants are really difficult to recruit as well. So the principle is about why we do it in a collaborative way, is about really trying to make sure we're maximising the use of our resources. And what Judith's hopefully really helpfully talked you through is the practicalities of some of the things that have been done to achieve the outcome, which ultimately is a really positive one, because it is about reducing waiting times and waiting lists for young people, which I think is a really important outcome. So a couple of quick points then. Joanne first, and then Pat, and then we'll look to close. Joanne?
Yeah, Edith, it's really helpful and really interesting and really encouraging to see all those touch points, and to know that people are being triaged so that they get the right treatment in the right setting, and therefore the severe cases are then go into the inpatient services, because that's what they need. Just a question about the single point of access. Yeah, so because it's the 5 trusts, can you just share with us how that single point of access is working? Is it that there's a single point of access in 5 different bases, or is it that there's a single point of access in one big sort of, core place, which then delivers and sorts it all out? Because again, getting those pathways sorted out so it works in a streamlined way is definitely the right way forward. Physical health could do with that as well in the community. So how does it work? Yeah.
Thank you, Joanne. Judith, are you able to answer that, or shall we ask Dave to comment?
I think for the sake of time, Dave might come in here. Thanks.
I think we can pick it up offline for time, Krishni. It's quite detailed, so you can send it through to me, Joanne.
Okay, but in principle, it's a joined up single point of access, isn't it? Rather than lots of individual ones. So without going into the detail, which I don't think we need, I think we just need to explain that it's not single points of access all over the country. I think that's right.
No, that's the whole point of it. Yeah.
Yeah, exactly. So absolutely integrated is the point, I think, Joanne. So important to say that. Pat?
Hi, my question was just around about the ambassadors. So from a carer's perspective, you say you call them ambassadors, but what is the, how do you sort of bring them in? What is the criteria to have sort of become an ambassador, say, to carers? Because what I hear a lot of from parents, whether it's for the CAMHS part or as they progress into the next bit of mental health caring, is that the parents or the carers are not, they don't have enough of the so-called ambassadors or peer support workers. So I'm just curious as to how, because if you've got 5 boroughs, that's a lot of different cultures and different types of people and different types of needs. So just curious as to how that's done, basically.
Thank you, Pat. I think we're going to have to take that one away because we probably haven't got time to explore that, but we'll look to respond on that one, Pat, after the meeting. But so there's something there. I think broadly it might be helpful just to talk a little bit about, because I think Susan also mentioned in the chat something about how we get, children children and young people's input and making sure that it meets their needs. So there's a lot of work on CAMHS participation. I know there's a group on CAMHS participation. So we might want to share a little bit about that, and also the way in which some of the other input and co-production happens within the collaborative. I think those are the key points that people have made in the chat. So we'll pick that up. Linda has also helpfully answered the single point of access. Members may sit in different locations, but it is a single point of access, which is the important point. So thank you very much, Judith. It's a really important area of focus for us. And we wanted to talk a bit more about a practical improvement that we've done in terms of services, because I think there was a little bit of feedback when we had our joint council and board session about the need for us to focus on things that we've done which have made a difference to patients and service users. And although, you know, we've talked a lot about improvements we've made on staff survey and other things, so we felt it was really important to talk about a really key service that we've been working on, and it's a great example of our partnership working as well. So thank you so much, everybody, for your contributions today. If there's anything else that you want to include within or raise questions about, please feel free to drop us a note or put it in chat if you can still access it after we close the meeting. I'm conscious that we've just gone past midday, so we need to close the meeting, the public meeting now. And I'll take it there's no other business because nobody's highlighted any to me, but absolutely want to encourage you to send any questions in or bring any other points to us that we can pick up after the meeting. At 12:10, we're going to be starting our private meeting, which is a relatively short meeting, but I really would like as many governors as possible who are here today to join that private meeting, because it's an important, some important input we need for a final bit of discussion in private relating to chair and non-executive director appraisals, which are an important part of your role. So I would really appreciate you joining that meeting, which starts in a separate link at 12:10. And if anyone's got any problems with that link, please do contact Tracy or Joe in the meantime. So I look forward to seeing you there. But thank you all so much for your input. Really appreciate it. And I'll close the meeting now. Thank you.
Thanks,
Thank
Krishni.
you.
Thanks,
Bye.
everyone.
Bye.